Welcome back to Preserve Health Talks. We are so honored to have as our guest this morning Shondia Sabari from Bold and Breastless. And boy, does she have a story to tell us. So, good morning.
Good morning. Thank you for having me.
And what is your story?
So, I was diagnosed with breast cancer at 36 years old. I had no symptoms, no signs, nothing to suggest breast cancer. One day I was getting dressed, getting ready to go to Dollar Tree, and something just said, you need to get a mammogram. That next day I had an appointment scheduled with my GYN. She put me in for a screening mammogram. That next week I received a letter in the mail that they saw calcifications, changes in tissue, some fibrocystic changes going on. I needed to go back for a diagnostic mammogram. Went back for the diagnostic mammogram, did the biopsy, and I had ductal carcinoma in situ in my right breast. I had an area that was lobular carcinoma in situ in my right breast, all stage 0. In my left breast, I had just the DCIS, but I had stage 0 and I had stage 1A that was near a blood vessel.
And you had no symptoms whatsoever?
No symptoms, no, sir.
So you just had this vision or this internal voice or perhaps a message sent to you that I need to do this?
So I didn't hear any voices, didn't see any shadows. I believe in God, so I believe it was the Holy Spirit that prompted me to do that. I didn't literally hear anything, and the best way I can describe it is, say if you're leaving home and you know you lock your door, but then as you walk into your car, something just says, "Did I lock the door?" So it was that same type of thing that just prompted me to get a mammogram.
But you had no pain, you
No,
felt
sir. No,
masses, you had no discharge from
nothing.
anywhere.
No discharge, no itching, no burning, no lumps, nothing.
Wow.
Yeah.
Wow. So what is the name of your organization and what are some of the things that you do?
Thank you for asking. Bold and Breastless, Inc. So we provide emotional support for others who are going through breast cancer. If they become unemployed due to diagnosis or treatment, we help we help buy groceries for them, pay for their utility bills, transportation to and from their appointments, help with child care. So we just try to be there for them emotionally and financially as much as we're able to.
That's awesome.
Now, there was no genetic component to your breast cancer,
No, sir, I was not BRCA positive.
but you had both breasts removed?
I had both breasts removed. So my surgical oncologist did not have to remove both breasts, but because of the area on my left breast, the 1A that was near the blood vessel, she had to remove that one. But I just told her to cut both of the little chicken gizzards off. And I called them chicken gizzards because they were so small. They were A cups.
And we can't laugh on the show because then we'll lose track, but that's humorous. Did you have a hysterectomy also?
Yes, sir.
Oh.
So because the breast cancer was ER and PR positive, 2 months after my bilateral mastectomy, I decided to do total hysterectomy with a oophorectomy.
And did they do radiation?
No, sir. So I did not have to do chemo or radiation. My Oncotype DX score, and as you're aware, with the Oncotype score, you get a score between 0 and 100. If the score is a 30 or higher, the chances of a recurrence is high, and you'll more than likely benefit from chemo and or radiation. My score was a 7, and I'm not a preachy person, but I do believe in God, and I know that in the Bible 7 means completion and perfection. So that just tells me that my journey was a perfect journey, and it's completed. And so I'm just really thankful.
And did they put you on an estrogen blocker?
So I did. I took letrozole, Femera, for 5 years. Didn't have the only side effect was it made me sleepy, and so I would take it at night so I can rest well.
Good.
And I'm sure your family was a huge support for you during this. What role did they play during your journey?
Absolutely. My husband and my children were so supportive. They asked questions. They wrote down questions to ask my medical team. We prayed together. We talked. We laughed. And when I say we talked, we just tried to figure out a way, like what can we do? How can we make this easier? How can we get through this? And so that was very important for my children and for my husband to be involved.
So what advice would you give someone for identifying their support system?
I would say to make sure that you select people who you know that truly love and care about you, and that you truly love and care about them, and someone that you trust, someone that will ask questions for you, even when you may not understand, or even if they don't understand, to get clarity so that they can better help, a person along their journey.
We all take things for granted.
Mhm.
What did you take for granted the most prior to your diagnosis?
Time. I took time for granted. I lived before my diagnosis each day as if tomorrow is coming, and the next day is coming, and then the day after that is coming. And I would just live focusing on the next day, the day after that. And so now the most important thing for me is to appreciate the fact that I'm living to see this day, and not being negative that tomorrow may not come. But when tomorrow comes, I embrace that day just like I embrace the day that I'm in.
So, what or who inspired you to be a guest on the podcast and speak about your journey?
So, you, sir, when you and I met for the first time 3 days ago, we kind of got to know each other a little bit. And when I asked you about your children, the way you spoke about your children, it wasn't so much what you said, it was how you said it, with a glow on your face about each one of them. You were so candid, so real, but then I could also tell that you have so much love for your children. I wasn't raised by my mother and my father. I was raised by my grandparents. So I don't know what it's like to hear a parent speak of their children the way that you spoke of your children. And that touched my heart. That was the yes for me to go ahead and do this podcast. So thank you for being a blessing to your children, your wife, and for blessing me too, because I love to see parents love their children.
Well, thank you.
You're welcome.
That's amazing.
Thank you.
What is a good medical team to you, and why is it so important to have one?
A good medical team to me is having board certified physicians, nurse practitioners, RNs, nurse navigators, rad techs, everybody that will have a hand in my health or someone else's health, that is personable, that is professional, that is up on the latest and most current research, and that just enjoys doing what they do. Some people go to work, not just in the medical field, but all careers. Some people go to work because it's a lucrative career, but then you have people that go to work because, in addition to it being a lucrative career, they really enjoy doing what they're doing. So for me, it's very important to just have a very, caring medical team, and have people on your team that are highly skilled, highly trained, and that really and truly love their job and their patients.
This is a life-changing event. How did it change your outlook on life?
So now, I always, the people that are closest to me, that I love and that I care about, I always treated them with kindness. I always treated them with respect. But now it means so much to me to just pick up the phone and say, hey, I appreciate you being in my life. Just like I appreciate you all doing this podcast and having me here. So you will never know how much this means to me. So I believe it's important to just thank people and tell them, while I have life, how much their blessing me is a blessing to me, and how much it means to me.
And everybody's breast cancer journey is not linear. So,
Mhm.
what would you say was the hardest part of your journey that you found throughout your time?
The hardest part for me was not knowing what the outcome was going to be. I remember a cousin of mine calling me from my home state of South Carolina one day, and she says, oh, you're going to go to that doctor, and that doctor's going to tell you they don't see anything. And then each appointment I went to, they kept saying the cancer was there, and I was like, what is she talking about? They're still saying they see the cancer. But I didn't realize what she was saying was really true, that at the end of it all, there was nothing else to be seen. So sometimes, things will happen to us. God will allow things to happen to us, and we can't see the full picture right then and there. Sometimes it takes a process for us, for us to see it. And so, I knew that, some kind of way that everything was going to be all right, because my grandparents that raised me, my grandmother always said, always have faith and things will work out for you. But it was hard just not knowing, like, okay, what's going to happen? Like, what are they going to tell me when this is all over with? But I got through it.
So tell us a little bit about your organization, the Bold and Breastless, and how do people donate to that?
Okay, so if people want to donate, they can go to boldandbreastless.com. There's a link on our website to donate. And again, we try our best to help assist women and men who may be unemployed due to treatment or diagnosis, and they may need help with paying utility bills, buying groceries, transportation expenses to and from their medical appointments, and if they have a family member or friend who is staying overnight with them at the hospital, like if they have to stay for their surgery, so then we help with toiletries, we help with buying them food and snacks, just to have. And also, we give gift cards, because sometimes after surgery, they may not have somebody to come in and to cook and to clean for them. And so we try to help with those expenses.
What a bittersweet but wonderful story you have. Thank you so much for being our guest today.
You're welcome. Thank you.
And thank you, everyone, for watching Preserve Health Talks.
Thank you, sir.